Hello, my name is Oruebubechukwu Asogwa, and I am conducting a systematic review on the relationship between video game use and attention deficit hyperactivity disorder, or ADHD, among children and adolescents. So why did I choose this topic? While shadowing at a psychology clinic, one of the most frequent or common disorders amongst the children I observed was ADHD. And when I asked them what their favorite activity to do in their free time was, video games was by far the most common answer. So I just thought it would be interesting to study the relationship between these two. And so the goal of this systematic review is to evaluate the impact or the relationship between video game use and ADHD in children and adolescents. So what is ADHD? Attention deficit hyperactivity disorder, or ADHD, is a behavioral condition characterized by persistent patterns of inattention, hyperactivity, and impulsivity. Academic and professional underachievement, interpersonal conflicts, and low self-esteem are some effects of ADHD. The worldwide prevalence rate of ADHD is 1 in 20 children, or around 5%, and the male to female ratio in clinical studies is 4:1. The prevalence rate of internet gaming disorder, or IGD, among children and adolescents is 5.5%, and the percentages by sex are 6.3% male and 2.4% female. Daydreaming a lot, forgetting or losing things a lot, squirming or fidgeting, talking too much, making careless mistakes or taking unnecessary risks, having a hard time resisting temptation, having difficulty getting along with others, talking excessively, or acting as if driven by a motor are all examples of clinical symptoms of ADHD. And some symptoms of internet gaming disorder are preoccupation with gaming, withdrawal symptoms when gaming is taken away, such as sadness, anxiety, or irritability, developing a tolerance, the inability to reduce playing or unsuccessful attempts to quit gaming, giving up other activities, deceiving family members or others about the amount of time spent on gaming. And this systematic review included literature published from 2013 through 2023. PubMed, Sanal, Embase, Eric EBSCO, Eric ProQuest, and PsycInfo were all the search databases. The inclusion criteria were articles on children and adolescents less than or equal to 18 years old, and an observational study design, such as case control studies, cohort studies, or cross-sectional studies, were also part of the inclusion criteria, and articles published from 2013 through 23. The exclusion criteria were review articles, articles on the adult population, articles not published in the English language, and intervention studies. And this is a Prisma chart for my systematic review. So at the top here, 173 articles were retrieved from these databases, and 40 duplicate articles were removed. And then 133 articles were then screened. Out of these 133, 100 articles were excluded based on irrelevancy. So then 33 articles were sought for retrieval and assessed for eligibility. Out of these 33 articles, 15 studies were excluded. 3 were excluded based on age. 1 was excluded because it was a review paper. 1 was a non-English study, and 10 had the wrong study design. So in total, 18 articles were extracted and included in the systematic review. The location of the studies, or the population description, were 39% were conducted in North America, 33% were conducted in Asia, and 28% were conducted in Europe. And then the description of studies, 26,480 total subjects were studied. 8 of the review papers were cohort studies, and 7 of the reviewed articles were cross-sectional studies. 2 papers were longitudinal studies, and 1 was a case control study. Now, as for the results section of the inclusion and exclusion criteria, this is different than the methodology. 29% of the articles reported no inclusion criteria, 26% of the articles reported no exclusion criteria. 26% of the articles reported neurodevelopmental disorders, or NDD, as an exclusion criterion. 7% of the articles reported bipolar disorder, dissociative disorder, or psychotic disorder as an exclusion criteria. And for the measure of video games, one article used the game addiction scale. 2 articles used the Young's Internet Addiction Test. 1 article used the Internet Gaming Disorder Scale. 1 article used the ADTech Video Games or ADTech 5 questionnaire. And 12 articles used the self-report scale. Now, 4 articles used a self-report questionnaire for measuring ADHD. 1 article used the Vanderbilt ADHD Parent Rating Scale. 2 articles used the Connors ADHD Rating Scale. 2 articles used the Swanson, Nolan, and Pelham Rating Scale. 1 article used the Children's Interview for Psychiatric Syndromes, the parent version. 1 article used the Strength and Weakness of Attention Deficit Hyperactivity Disorder, Symptoms, and Normal Behavior Scale. And 3 articles used the Strengths and Difficulties questionnaire. Now, for the association between video game use and ADHD, 8 of the reviewed articles reported that children and adolescents with ADHD tend to have significantly more video game use and are more likely to develop pathological or excessive gaming problems. 6 of the reviewed articles reported that video games lead to an increased risk of developing ADHD. 2 articles found that digital gaming or aggressive video game use are not risk factors for developing ADHD. And 1 article reported that children with internet gaming disorder tend to suffer from predominantly hyperactive ADHD. Now, this is the discussion portion of my review. So the aim of this systematic review was to study the relationship between video game use and ADHD in children and adolescents. The systematic review had variable findings, with the worsening of attention span following video game use as the most common finding. This variability and my findings was due to the difficulties in assessing video game use because there was a lack of uniformity in the scales used to assess video game use. So there have been neurobiological explanations suggesting that video game play may improve attention span through the activation of neural networks by triggering distractor suppression mechanisms, aiding in the reading process, and the activation of the dorsolateral prefrontal region and insular subregions, and greater connectivity between the tempoparietal and frontal lobes. These biological reasons may explain the findings of some adult papers conducted by Steenbergen and others in 2015, Gan and others in 2020, and Yao in 2020, showing improvement in attention span following action video games and improvement in cognition among children and adolescents who play video games. Children and adolescents diagnosed with ADHD, mostly the impulsivity trait, have a higher risk of being addicted to video games due to cortical hypoactivity. Greater problematic video game use was observed in those with ADHD compared with controls. This is in accordance with a study conducted by Bayer et al. In 2012. Findings from Galera and others show that the hyperactive subtype of ADHD is predominantly found among younger children than older children because hyperactivity decreases with age. 3 of the articles reviewed found that hyperactive ADHD plays a significant role in the development of internet gaming disorder. This is consistent with previously published literature by Bayer and others in 2011, Paulus and others in 2018, Avropoulos and others in 2019, and Stritmatter and others in 2015. So in this presentation, I gave a fairly brief overview of my systematic review. I went over the aim of this review, what ADHD and internet gaming disorder are, the methodology of my systematic review, the results of my systematic review, and then the discussion of my systematic review. So thank you all for tuning into my presentation. I hope you guys all learned something about video games and ADHD and about the relationship between the two. And I hope you guys all have a great day. Thank you.